Welcome to an HMC HealthWorks podcast. Today we're joined by Patty Bell, and she's an English teacher at New Britain High School in Connecticut, and she's also a parent. So she has two unique perspectives. We're going to be discussing all of the questions and concerns that people have with the back to school coming up. Patty, thanks for joining us.
Thanks for having me, Vicki. I appreciate you reaching out to me.
Good. So, Patty, right now I know there's one question that's really at the top of many parents' minds, and that is it safe to send my child back to school this fall?
I wish I could give a simple yes or no, actually, and there are times where I am paralyzed with fear, and at other times I'm perfectly comfortable with the idea, and I go back and forth. The truth is, it's complicated. There's no perfect choice, so each family needs to weigh the benefits and risks and make their own decisions. When it comes down to each child's needs, each family's circumstances, and what's happening with the virus locally, I know in Connecticut we're fortunate that we're under the 1% mark of people being affected. So having the schools all submitting plans for the safety and health of the children, it in theory it sounds like it's going to work, but then again I'm human and I'm worried as well.
Yeah, that it definitely makes sense what you're saying. So, nobody's going to know, as you said, until they try to, bring this all together.
Correct.
It's sort of like being part of an experiment. One of the things that I think people are trying to weigh as parents is basically like, if they're going to make that choice, what are the benefits for going back to school?
Having experienced the ending of last school year, being home and teaching remotely, you realize you lose a lot of that in-person, that rapport, the classroom environment that comes with being at school. Studies show that nothing comes close to the experience of in-person learning, and all teachers strive to make their classrooms an inclusive, safe learning environment. They develop rapport with students. It's so much more than just the everyday instruction. There's relationships built. And being in the classroom, it's stimulating and developmentally appropriate for the students to learn, and it's hard to replicate that at home. Many homes aren't set up as a classroom would be or have all the resources. For instance, if your child struggles to stay on task with time management, replicating that kind of structure at home would be difficult compared to a physical classroom setting. And there's the whole idea of special services as well. I know in our district, support staff such as social workers and such, and special ed teachers all did remote practices in the ending of the school year last year, but nothing takes away from in-person contact.
Yeah, definitely. In fact, that you read my mind. That's what I was getting ready to ask you a minute ago, was about the special needs and the special services. And I was also thinking about, school for families in terms of being a safe environment and providing child care and also critical services like meal programs. So, it sounds like that falls into the category that you're saying, too, that there's really no way to fill that need if they're at home.
Correct. I know in our district we have 100% meals, breakfast, lunch, and dinner programs, 100% free for all students. What they did was they did basically a Meals on Wheels for when we closed in March, and did daily food trucks that had certain locations in town for pickups, and they were actually delivering meals to families as well. So that's just one component to a regular school day, that besides receiving meals, it gives a safe environment for students to be where when their parents go to work. And a huge part of it is the social development, interaction with other peers, as well as adults, to develop, just certain interpersonal social skills, language, communication, how to be part of a community. And we've always stressed that our school is a community within a community, and we reach out to other community resources at this time. I know that during the last ending of the school year, we have a large number of our student population that doesn't have access to Wi-Fi. Well, they don't have access to devices, and our district provided 100% devices for students, and then through partnerships with different businesses in the city, they provided mobile hotspots for Wi-Fi.
Wow, I'll tell you, it's good that they were able to pull those community resources together, because as you were saying, for a district to try to tackle that all on their own, that probably would have been a mission they weren't able to accomplish. So all of the things that you discussed in terms of, being able to be part of a community, the interpersonal relationships, just everything that's beneficial about school. You basically just summed up why so many people really wish their kids could go back to school. But of course, there are risks for going back to school. I mean, we all know there's no way to open schools without opening up some risk to COVID. I know that Connecticut Children's Hospital indicated that the good news is that kids appear, less likely than adults to become seriously ill from COVID. But although it's not widespread, I know that there's been exception with something they call pediatric multi-inflammatory syndrome. And I actually have a friend in Colorado whose 2 children, unfortunately, contracted that. So they both recovered and they're fine. But, that was a rough time for their family. So I think in their case, even though they're younger children, they're not going to send them back at this time. I also saw that some kids under the age of 12 are less likely to spread the virus, to other people than maybe older kids or adults.
And it seems that, unfortunately, teenagers seem to be very strong COVID spreaders. So if your teen becomes infected at school, or many of our teens are out, they're actually have been continually working as essential workers in food services and healthcare services. So if they become infected, there's a good chance that they'll bring it home. And many of our families are multi-generational families living together, so they may have older grandparents living with them. And even for the younger kids, although the chance is smaller, there's no guarantee that they won't become seriously sick or infect somebody. Our biggest fear, one of my biggest fears, is transmitting the disease as opposed to contracting the disease. So there's still a lot we don't know about the disease itself.
Yeah, that makes sense. And, for you, it's really true because, since you're a high school teacher, I mean, you're among those teens, the spreaders, as you said, and you definitely have concerns.
It's definitely why people are so apprehensive about the idea of being at school in person.
Yeah, I can certainly understand, just having that fear and concern. So, before we did this podcast today, you and I talked last week, and at that time you were getting ready to have meetings about what the plans were, and, I know you can only speak to what's being planned in Connecticut and how that might look in your district, but I'm wondering, can you tell us a little bit about, how the schools, try to control possible outbreaks?
Right. They had our district had town hall meetings via Zoom, and they, with the facilities manager and safety protocols, it sounds like a really sound, safe plan for sterilizing classrooms and having one designated room as an outbreak room, just in case if there's any. It's being um, supervised by a healthcare professional outside, somebody from not working within the school district. And as the protocols that they are putting into place is grouping students into cohorts, and those cohorts for the buses and the cohorts for the classrooms, and moving to a block schedule format. So the students all, for the most, trying to keep the same grouping of students together as much as possible. So if there is somebody who unfortunately tests positive or has symptoms, they can isolate quickly and shut down. But with all of those measures, it's like this. There's so many buildings, and the buildings are quite large, and so many touch spots that there's only so much you can do to keep it sterile. And so, being in a physically large building with even our population, we were talking about returning on a hybrid model where only half the students come in 2 days a week and the other 2 days a week. And even with that, our population is so large, it's still a substantial number of students, and all the while you have the option to stay remote, to stay home and learn remotely. But that just means that the teacher sits at the teacher's desk and teaches from a computer to a socially distanced classroom that has been stripped bare of anything except for desks and chairs, and students on laptops.
Yeah, that looks very different than, the experience we would hope our kids have, and also for the teachers. It's
right.
Very different. I was wondering, when you guys were meeting, did you get some information, or, how, you talked about the measures they're going to have in place to try to basically, deter outbreaks. But I was wondering, do they have other plans, with the schools to catch outbreaks early enough to prevent something widespread? Have they talked anything about that?
They have. They've talked about how teachers who have traveled to certain places have to self-quarantine, and I don't know where this extra staffing is going to come from to take their places, or if there's a family member who's sick, the staff will have to self-quarantine and not come into the building. Same with students who, if there's one student who is symptomatic, it shuts down. And the idea of teaching live in the classroom, off of the computer, live but remote to the students, is the idea that at any moment in time, school can shut down and we move seamlessly into fully remote instruction.
Yeah, so when you're talking about going to the remote instruction, I did want to ask you, do you feel like, from having already done the remote instruction, I think you guys started in March until the end of the school year, do you feel like that there were things that you encountered that you learned from yourself as a teacher and as a parent, and then the district, that they'll be able to, take forward and it'll be smoother than, maybe other places? Just sort of like a live and learn? Do you feel like that you ran into
Definitely. A lot of the students adapt quickly to the different technology platforms. It gave teachers the opportunity to utilize, and many have already had been utilizing, like something like Google Classroom or Google Meet. The district now is introducing a few more different types of technology and platforms, and they're doing summer technology institutes where teachers can voluntarily be trained using these different platforms, and they're offering professional development at the beginning of the school year as well to become proficient in using the technology. Something that the students adapt very easily to, many of them, not all of them, the younger ones still have trouble, obviously, understanding the difference between playing a game on the computer and learning how to set up a document or upload image. So depending on the level of ability, it varies, and it puts some students at a disadvantage, while others adapt very well to it. The older students tend to adapt better to it. I know in my son's case, he was already taking a few college courses while still in high school, and transferring over into just a remote setting, it was pretty seamless, and they were able to adapt it pretty quickly.
Yeah, that makes sense. And, when you're bringing up the difference between maybe older children and younger children, I think you're correct in saying sometimes for the younger children, trying to differentiate between, the computer for pleasure versus the computer for learning and being able to go back and forth makes sense. So, something else.
It puts an awful lot of responsibility on the parents, too, because teachers aren't being introduced to these new programs, and parents have never been introduced to these programs.
Yeah, that's a burden for the parents, especially if
it's a huge burden for the parents to work through that. And you could send as many written instructions as you want. It's still not the, or even YouTube how-to videos. It's still a lot to master.
Yeah, definitely. I think that's another reason the parents want their children to be safe, but that's another reason they're also eager for them to go back to school, because, as you said, there are so many challenges, when the kids are home. Another thing I was thinking about that a few parents had talked to me about, they had children that had always been very active in sports, and I know that just in our society, in professional sports, there's all types of discussion and different models. I was wondering, though, if there's been any decisions in your district. I know that I had read at the state level that it's up to the individual district if they're going to have kids, playing contact sports. But honestly, I was wondering. I mean, if you think about a contact sport like football, I mean, they're in such close proximity and they're breathing hard and they're often shouting.
Right.
And that's really the way that the virus spreads. So, there seems like there would be a good chance that they might infect other players if they get infected.
And I can't imagine football players wearing a mask as well.
Yeah. Well, I was thinking,
right.
They've got the helmet, but it's not
right.
It's not the same protection. So, has your district made a call as to what the sports program? I have not heard anything official. Just yesterday, I heard that University of Connecticut has canceled their football season. Yeah.
So I think if college level is doing that, I think the high school levels are going to probably fall into line and eliminate. I mean, they're still, for some reason, they're still having band practice.
Yeah,
and that's a big deal.
That is a big deal. But I don't know. I don't know because I never was in the band. I know some kids that were. Yeah, it seems like that might not be an ideal thing with the blowing and stuff like that.
Mm-hmm.
But I guess maybe they have ways that they're dealing with that. So, another thing I wanted to ask you about, before we move off the topic of sports, I know from my family and other people, whether it's kids or adults, one of the things during the pandemic that they have been able to do to get out and have, experience with the sport and be able to do it fairly safely is golf. And
right.
They've been able to keep the distance. They have things where they're not using the rake or they're not getting the ball out of the hole. And I'm just wondering, is that a type of sport that, if a school has a program, is that a type of sport that might be doable?
I believe it's doable, but I think out of equity to all the other sports programs, that if they're not going to do, say, tennis in the spring or any of or baseball as a spring sport, then the call was made last year. It wasn't just one sport, it was all sports were canceled. And
that makes sense. Yep.
And it's probably, I know my son works at a golf course and they have very strict social distancing guidelines, and and the golf course never closed during the pandemic. It was one of the few places that never had to close, as long as they had very strict social distancing guidelines in place, and were having their clientele follow that protocol. But as far as it being a sport in school, and my son was on the golf team, it was just disheartening. And all spring sports were canceled, and I think as a district, if one sports group can't participate, then out of just camaraderie and fairness, none of them participate.
That makes sense. I'm really looking at that in a different way with you explaining that. It definitely would make people sort of more team oriented in terms of the way that everyone's coping. It's more important to be part of the bigger team that's trying to be safe than just to say, okay, our team can actually do this without as much risk.
Right.
And that makes sense, and I really appreciate you pointing it out, and that'll be good for parents and students who hear that and rethink maybe how they're looking at it. The last thing I wanted to ask you about is, with all that we've been discussing, it sounds just like so much of this, some of these things can be prevented, even though there's a lot of moving pieces. There's a few little, what I would say, sort of building blocks that can be sort of like the start. It doesn't mean that everything else is going to fall into place, but sort of like the main starting point. And, I was wondering, it seems like that one of the biggest things that people could do to help prevent things turning into a worst-case scenario is if all the students and teachers were vigilant, wearing masks and with hand hygiene. And I was wondering about that, especially with teens. I'm wondering if that's more of a challenge because of
in theory, I mean, obviously, the one thing that would stop the spread, because we do have a way to stop the spread of the virus, is wash your hands, wear a mask. Wash your hands, wear a mask. Our district, I know, worked with one of the factories in town who supplied all the materials, and we set up in our gymnasium with volunteers to assemble face shields. So every student will receive 2 face shields at the beginning of the school year, as well as teachers. They'll be required to wear the face shields and supply their own masks. And so they'll be required to wear masks and face shields every day. The idea with the little ones having 2, the idea is, at home you wash one and you have the other one ready for the next day. And although it's uncomfortable, they plan to work in face mask breaks throughout the day, where teachers would take children outside so they could take their mask off for a short period of time. And even during inclement weather, I learned through our town hall meetings for our district that each school has rented huge tents. So even in inclement weather, teachers can take their classes outside for these face mask breaks, and they're encouraging during nice weather for teachers to bring their kids outside and try to teach outside as much as possible. Yeah, which management-wise, to me, gives me agita, but that's a request that's being made from administration that, but then that brings up a whole lot of, to me, it brings up a whole lot of other safety issues. However, they're trying to address the technology issues with it and doing more wiring and more connectivity outside the buildings to have Wi-Fi. So you can grab a Chromebook and take your, everybody grab their Chromebooks and take their classrooms outside.
Wow, there's so many layers of this, and
there is.
It's a lot to think about, and I really appreciate you joining us today and sharing these insights. And this is such an important conversation. And there aren't any easy answers, but I feel like at least with some of the stuff that you've discussed, you've touched upon what people's concerns are. You've also given information about ways to respond or plans that they're hoping will come to fruition to make things smooth. So just really appreciate it.
Thank you. It's been my pleasure.
Oh, Patty, we're so glad to have you. And I'm going to ask you before we close if you might be willing to come back when we get a little further into the school year starting and sort of give us an update or progress of how things are going.
Absolutely.
Great.
Absolutely.
So, it sounds like I want to, with our listeners, that, determining if it's worth the risk to send your child back to school, it's not a simple yes or no proposition, as Patty has indicated. It's a very complicated issue, and it also depends on the health of your child, the health of your family members, and basically the health of your community. And as Patty, really thoroughly discussed, if your child has individual needs when it comes to learning or social, emotional development. I'd really like to thank all the listeners for joining us today and advise them to go to hmchealthworks.com and review our checklist to help parents decide send kids back to school or keep them home during COVID-19. Stay tuned for future HMC HealthWorks podcasts, and remember, stay safe.